If you decided to take the plunge, you're going to pelvic floor physical therapy, what is going to happen when you get there? The idea of pelvic floor physical therapy can seem daunting. And having done this for 20 years, people come to us at different points. Sometimes they find us themselves online, or sometimes they're referred by their doctor. We have no idea what they've been told before they get to us. So today's video is going to cover the things that we go through on evaluation day, hopefully to make people feel less nervous about coming to a physical therapist when there's urinary, bowel, sexual dysfunction, or pelvic pain. So when people are coming to see us, the first thing that you should know is you're not alone. And it's so important to know that. And so many times patients have said to me, oh, everyone in your waiting room looks so normal. Because when people have these symptoms, they think that they are alone and that they're not normal, when in fact, these things are very common. We've heard it all before, we've seen it all before, and we know how hard it is to walk through the door for the first time. So when we start the appointment, you're fully clothed. We sit across from each other, and I want to hear what are the most bothersome things to you. What do you think is happening with your body? What are your symptoms? What are you worried about? As we go through the history, then I start to ask more pointed questions when you start to tell me things about your symptoms to help me get the information that I need to do the physical exam. I will leave the room, allow you to change. Patients drape themselves, and then they wait for me to come back. When I come back, I'm going to explain that it's not just the pelvic floor muscles that are involved in urinary bowel and sexual symptoms, but actually most of the muscles and tissues that go from your ribs, at least to your knees, and including your thought process and your brain. But for the physical exam, I'm going to explain everything that I'm going to do, which is going to be a manual exam to touch the muscles, the tissues, various nerves, and see what's reactive, what's normal, what's maybe dysfunctional. We'll explain this all as we go, and often the evaluation day and the physical exam can be a little surprising. People know that they have symptoms, but they may not realize that some of these areas are involved. And so if a certain muscle hurts, maybe in the inner thigh, most people had no idea that was even a problem. But as we tie the story together with the symptoms and then the physical findings, we're able to explain to somebody by the end of the appointment what's actually going on. So we do the external portion first. We finish with the internal exam, which may be transvaginal, transanal. And then I leave the room again, allow my patient to get dressed, and then I come back and we talk. And this is the most important part. We talk about how the symptoms developed. What are the physical findings that match the symptoms that you feel? And what do we need to do to get out of the situation? So a physical therapist does short-term goals and long-term goals as part of our overall assessment. And what that means is, let's say that during the physical exam, I found that somebody can't contract and relax their muscles and that there's pain in certain muscle groups. So a short-term goal would mean we are going to execute manual therapy for the next 4 to 6 visits to reduce muscle pain in the pelvic floor, which will in turn reduce painful sex. A longer term goal would be something that is set for 8 to 12 weeks, and that would be you can return to pleasurable intercourse. But in order to get to that long-term goal, the short-term goals that are tied to the physical findings are something that we're going to be working on every week in the clinic, and we're going to give you things to do at home. Those home programs will support what we're doing in the clinic, and the way we operate at PHRC is we want to do things in the clinic that you can't do for yourself, and then make sure that the things you can do for yourself at home are a great use of your time. And so that involves typically things like foam rolling activities or therapeutic exercise. In the clinic, we're doing manual therapy in a closed private room to help you get to where you need to go. Each week we talk about all of the things that led up to this point and hopefully help people make sense of how this happened. There's nothing wrong in the big scheme of things because these problems are so common, but they're embarrassing and they affect every aspect of our life, and we understand. And in fact, many of us have been there ourselves too. So over the course of therapy, in addition to what we do with the clinic and your home program, you also may need medical management. And at that point, we have very close relationships with our referring providers and other people in the community that can help with the medical aspect of your care, which so many times our patients have been managing on their own before they get to us. And it's very difficult to do, and we understand that. So we will work with you and your other providers to make sure that you're achieving both these short-term and long-term goals and getting back to normal function. Hopefully this video has eased your concerns about what will happen in pelvic floor physical therapy. We're happy to see you in one of our clinics. If you happen not to live near one of our clinics, we will put a link in the description below about how you can find a pelvic floor physical therapist that's qualified to help you.